Good day, everyone. Welcome to Motherocity's Maternal IQ, where we provide less noise and more facts about maternal health care. I am your host, Lydia Simmons. Let's get into it. Arkansas is the latest state to provide mothers with depression screenings. In Arkansas, 2024 is bringing new mothers more access to maternal health services as the state will now require healthcare providers to ask mothers if they want to be screened for depression up to 6 weeks after giving birth. The new law mandates both private and government provided insurance programs cover the costs associated with screening in an attempt to improve maternal care in the state, which has one of the worst maternal and infant mortality rates in the nation. Arkansas is one of a growing number of states working to improve maternal health outcomes for new parents by implementing laws that incorporate maternal mental health into health care services parents can access. Despite the progress, barriers remain. According to data from the Policy Center for Maternal Mental Health, a nonprofit that works to close gaps in maternal mental health care through advocacy and policy, 13 states still have not passed bills that address maternal mental health. Additionally, even for states that have successfully passed bills addressing the issue, the parameters of care can vary significantly from state to state. California's screening mandate, for instance, requires that people be screened at least once during their pregnancy and then again at each of their subsequent postpartum visits after delivery. By contrast, Arkansas's new law covers screenings up to 6 weeks after birth. According to the Maternal Mental Health Leadership Alliance and the Policy Centers for Maternal Mental Health, the current recommendation is to screen up to the first year postpartum, as there are different times in that postpartum period that a maternal mental health disorder can avail itself. For those successfully screened and in need of care, services may still be hard to come by. A new survey reveals insights into Georgia's maternal health crisis. According to data being presented today as part of the inaugural symposium to address the maternal health crisis in Georgia, 1 in 10 Georgians know of someone who has died during pregnancy, at delivery, or soon after birth, and more than half have experienced or know someone who has experienced complications during pregnancy. Commissioned by Research America in partnership with the Woodruff Health Sciences Center at Emory University, and developed in collaboration with researchers and stakeholders across multiple state institutions, the findings highlight themes around health equity, mental health, access to care, and eagerness for state and federal support for research and action. Specifically, the survey found that substance use disorder, lack of insurance, and mental health rank as top factors perceived to contribute to an increased risk of maternal mortality. A Senate bill puts millions of dollars towards maternal health in the state of Florida. The bill puts hundreds of millions of state and federal dollars towards Florida healthcare workforce and access measures, Bill SB 7016. Florida senators on Thursday passed a sweeping package of changes meant to ease Florida's healthcare worker shortage and provide people with more access to care. The overall package will cost hundreds of millions of the state and federal dollars and was unanimously approved by the state. The legislation would expand a pilot program that focuses on maternal health care for minority populations. The program began in 2021 and uses telehealth to provide pregnant and postpartum women with education and services, as well as with medical devices to monitor things like glucose levels and blood pressure. The bill would set aside about $23 million to bring the program statewide. The bill would also grant more powers to some birth centers, which now only handle low-risk pregnancies and cannot do cesarean section. Under the bill, birth centers could get an advanced designation and be able to handle cesareans and administer anesthesia. Advanced birthing centers would need to be staffed around the clock and must employ an obstetrician and an anesthesiologist as medical directors. They must also have a written agreement with a blood bank and a written transfer agreement with a local hospital. The statute does not define how near the local hospital would have to be. When asked by some Democrats about the safety of the centers, the Florida House Speaker said that they are held to the same standard as ambulatory surgical centers. There are no direct incentives for advanced birth centers to be built in rural areas or maternal care deserts. The sweeping package does not consider expanding Medicaid. Texas mothers are one step closer to getting health coverage for 12 months following pregnancy. This week, the Federal Centers for Medicare and Medicaid Services approved Texas's plan to provide 12 months of postpartum health care coverage through Medicaid or Children's Health Insurance Program instead of the current 60 days. Those programs are for people who qualify based on income. The extended coverage will begin March 1st. The state expects approximately 137,000 women will benefit from 12 months postpartum coverage in fiscal 2025. This is not the first time Texas tried to extend coverage for postpartum people. 2 years ago, the state had submitted a plan to extend coverage to 6 months, but that was not approved by CMS in the hopes that Texas lawmakers would seek a 12-month extension during the 2023 legislative session. As of this month, 47 states and Washington, D.C. either have 12 months or plan to have 12 months of coverage. Only Idaho, Iowa, Arkansas, and Wisconsin do not. The popular baby clothing company Kite Baby has been trying to head off a consumer boycott over the weekend. So here's what happened. Marissa Hughes took to social media on Friday to thank all of her supporters for their kind words after learning that she was out of a job at the popular clothing brand. Hughes's family said she was fired after not returning from maternity leave in order to care for her newly adopted son. He was premature, weighed 1 pound, and was in a neonatal intensive care unit 9 hours from their Dallas home. According to Kite Baby's policy, an employee like Hughes, who had been with the company for at least 6 months, is allowed 2 weeks of paid leave. But when that time was up, Hughes's request to work remotely from the NICU was denied. What happened seemed very terrible, but here's why it was 100% legal. The new mom wasn't eligible for FMLA. Hughes hadn't been with Kite Baby for 12 months and was therefore not eligible for FMLA, the Family and Medical Leave Act. If she had been, she would have been entitled to 12 weeks of bonding leave. Parents, including adoptive and foster parents, are entitled to 12 weeks of unpaid leave to bond with their new babies, or older children in the case of fostering and adoption, so long as they meet the qualifications for FMLA. The Pregnant Workers Fairness Act doesn't apply either. The Pregnant Workers Fairness Act went into effect in 2023, providing additional rights for expectant and new moms, but because Hughes has adopted her baby, she was not pregnant and not covered by this act. ADA doesn't apply either. The Americans with Disabilities Act doesn't apply to employees' children, only to the employees themselves. Even though a fragile baby in the NICU was in desperate need of help, the ADA doesn't protect parental jobs when it's the children who need help. Companies aren't required to provide protective leave, which means leaves of absence where the employee is entitled to return to the same or equal position if the employee doesn't qualify. While some business owners may say they can't afford to give additional time off to people when the law does not require it, think about the cost to Kite Baby of this money-saving decision. Always ask yourself, is this the right decision, or is this just the legal decision? What are my 2 cents? Well, I'm a mom, and so I always err on the judgment of what's best for the mom and what's best for the family. I think every employer should be here today. It's 2024. But as we know, many are not, as childcare is a major crisis in this country right now. It's all the buzz, everyone's talking about it, and parents are really just tired and fed up of trying to figure out how to do both, work and provide childcare. In this instance, when you're considering the letter of the law against what's right for a person, I think there's no question, do what's right. If you're a company that hasn't changed its laws and provisions guiding your employees on the best standards to take in instances like this, then you have work to do. I think for all of us, all the parents out there, we would love to live in a world where we could envision a situation where there was no childcare issues, where childcare was free, where work leave was paid, and where we didn't have to fight for things that just seemed to be natural, especially when almost the rest of the world is already caught up to this idea. That's all for now. Thanks for having me. We'll see you next week.